21.1. Write a simple English phrase for each of medical terms below using your medical knowledge. 1. Hysterectomy. Surgical removal of the uterus. 2. Menorrhagia. Heavy or prolonged menstrual bleeding. 3. Salpingitis. Inflammation of the fallopian tubes. 4. Cervical biopsy. Taking a tissue sample for the cervix for examination. 21.2. Read the conversation between the gynecologist and the patient in C opposite and complete the notes about the patient. Menarche. The first menstrual period. Menstrual cycle. The time from the first day of one period to the first day of the next. LMP. Last menstrual period. Menorrhagia. Is your bleeding heavy? Dysmenorrhea. Do you have painful periods? Discharge. Any unusual vaginal discharge? 21.3. Now write the question that the doctor asked. Menarche. When was your first period? Menstrual cycle. How long is your menstrual cycle? LMP. When was the first day of your last period? Menorrhagia. Do you have very heavy periods? Dysmenorrhea. Are your periods particularly painful? Discharge. Have you noticed any unusual vaginal discharge? 21.4. Complete the case report. One word is needed. Twice. Case 15. A 45-year-old woman had been having heavy periods lasting for 8 days, with the passage of clots for 9 months. There was no bleeding between periods or after intercourse. Her periods were not particularly painful. She had not noticed any hot flushes or night sweats, and her general health had always been good. She had taken the oral contraceptive pill until a year previously, when a Cooper IUD was fitted. She had had a normal pregnancy when she was 25. 22. Chapter 22. The heart and circulation 1. A. Shortness of breath. Shortness of breath or breathlessness is dyspnea. At first, this is caused by exerting physical activity such as climbing stairs. But in severe cases, it may be present even at rest. A patient who is breathless when lying flat orthonia, for example, in bed, will then to sleep rise up on 2 or more pillows. The abbreviation SOBOE stands for shortness of breath on exercise, or on exertion, or on effort. Patients say, I get terribly short of bread-claimed stairings. Doctors can ask, how many pillows do you sleep on? B. Heart rhythms. The normal resting heart rate is 65 to 75 beats per minute. In athletes, it may be as low as 40 beats per minute. In extreme athletic activity, the heart rate can go as high as 200 min. The heart rate may be regular or irregular. In an irregular arrhythmia, there may be early beats which interrupt the regular rhythm, premature beats, or the rhythm may vary with respiration, or it may be completely irregular as in fibrillation. When patients are aware of irregularity, they describe the symptom as palpitations. Case 4. A 22-year-old student is admitted to hospital with a long history of heart problems. She had been increasingly tired, with shortness of breath on exertion, orthopnea, and palpitation. A mitral valve replacement had been carried out 3 years previously, and this had stabilized the symptoms of heart failure, but was followed by episodes, attacks of atrial fibrillation, which had been particularly severe for the 6 months before admission. C. Heart failure. Heart failure occurs when the heart is unable to maintain sufficient cardiac output. The amount of blood pumped by the heart each minute for the body's needs, it may involve the left side of the heart, the right side, or both. In left heart failure, the main symptom is breathlessness. The symptoms of right heart failure include peripheral edema, swelling, beginning in the feet and ankles. This is known as pitting edema when a finger is pushed into the swelling, it causes a small depression or pit. Aorta, tricuspid valve, septum, mitral valve, pulmonary veins, pulmonary artery. 22.1. Complete the conversation based on the case history and be opposite. Doctor, what seems to be the problem? Patient, you've been getting attacks of breathlessness. Doctor, how long have you had them? Patient, for about 6 months, but I've had heart problems for years, with tiredness and palpitations of breath. In the end, I couldn't walk more than 100 meters without having to stop. I had to sleep on 3 pillows. I had a heart transplant replacement 3 years ago, and that improvised things for a while. 22.2. Make word combination using a word for each box. 2 words can be used twice. At rest, atrial fibrillation, cardiac output, heart failure, on effort, pitting, edema, premature deaths. 22.3. Write the words a patient would use to describe the symptoms below. 1. Dyspnea, breathlessness, arrhythmia, palpitations, orthopnea, attacks of breathlessness at night. 4. Edema, swelling. 22.4. Complete the case report. Case 13. A 60-year-old woman attended her GP's surgery complaining of breathlessness on effort. This had been increasing over the previous 8 months until it was producing problems at around 50,000 meters walking on the label. There was no history of chest pain. She had had several episodes of fast heartbeats, which lasted 20 and 30 minutes and were associated with some palpitations of breath. She had noticed some swelling of her ankles by the end of the day. This disappeared overnight.